Season's greetings and good evening to all of you, Barbadians and visitors to Barbados. I trust you had a wonderful Christmas in spite of the challenges provided by the COVID-19 pandemic. Indeed, our presence here this evening speaks to that. In the middle of the festive season, 3 days after Christmas, here we are speaking about COVID. With me to join me shortly, the Attorney General, the Honorable Dale Marshall, and the Minister of Health and Wellness, Lieutenant Colonel Jeffrey Bostic, and the Chief Medical Officer, Dr. Kenneth George. As I said this evening, in the middle of the festive holiday season, when many of you are making plans in terms of Old Year's night activities, New Year's Day's activities, and certainly the consequential long weekend, where many activities are being planned, we thought it was imperative that we speak to you this evening concerning matters related to COVID and this country's management of COVID-19 at this point in time. Over the past few weeks, several persons have perhaps made comments in terms either in the print media, on the social media. There have been videos which have been circulated. Indeed, persons have written to the various ministries expressing some concerns as relates to the whole COVID management in Barbados. These go across a range of topics, be it the matters related to testing COVID. Persons express concern in terms of the time taken to get results. Persons in quarantine have spoken to the matters related to getting arrangements in place for their second test and indeed having access to the results from those tests. There are specific concerns that have been raised about quarantine, particularly in hotels and villas as it relates to those two types of quarantine facilities, where persons speak, indeed staff and other people speak of commingling of persons who are in quarantine and those who are not. And indeed, we've had some isolated cases of persons breaching quarantine and being able to leave those facilities. We have been listening to these comments, we've been reading, and as the Prime Minister said from the beginning back in March, that we'll be guided by the science. I think most of you will be aware that within the Ministry of Health and Wellness, there's a Health Emergency Organizing Committee which meets sometimes 7 days a week, sometimes well into the night, comprising of various public health officials and other technocrats. And I should mention, including the President of BAM, Dr. Linda Williams. Indeed, I'm told that they're meeting even today to review some of the things that are being discussed. I want to assure Barbadians that we maintain, in terms of looking at the science, we are guided by the deliberations of the Health Emergency Organizing Committee. We are also guided by PAHO and WHO directives. And of course, we make our decisions evidence-based decisions at the end of the day. And I can assure you that many of these issues are going to be addressed this evening in terms of where we go in terms of the plans within COVID to deal with these issues that have been raised from time to time. What I can say as a government is that we are also very concerned and seriously concerned when we see photos of large gatherings on beaches, especially, for example, on Boxing Day, and also at the races and at various other activities, as though some people in the midst of a pandemic, as though some persons believe that this pandemic is non-existent. And you see persons in public crowding together, no masks. Sometimes when masks are being worn, they're being worn improperly underneath your chin, and indeed with hardly any physical distances. And this is a shocker to us in government, and indeed it has to stop, and it will not be tolerated. One gets the impression that some persons in Barbados believe that life has returned to normal. Indeed, it has not. The COVID is still present. And you get this feeling that there is this feeling that, that we can just throw away the masks and the physical distancing. And these are the fundamental tenets that have been showed globally to be extremely effective and efficient in limiting the transmission and the spread of COVID in populations. And some of us in Barbados, are beginning to treat it as though they're not needed anymore, that we are safe. This also applies to the visitors to Barbados. We welcome your presence here. But while you're here, you must abide by our protocols. Indeed, wearing masks might not be comfortable. I have perhaps an advantage, some of you would say, having in a different life as a surgeon, having to wear them for hours, day after day. So I've become used to them. I know the mask is not necessarily comfortable for everyone, but the science is there. It shows you that you protect yourself, and COVID is not to be played with. You protect your life by wearing a mask. Similarly, in terms of hand washing and hand sanitizing, these are also very important. They're necessary. You protect yourself again. And indeed, the physical distancing that we manifested when the country was on lockdown, you did it voluntarily. You knew how effective it is. COVID is still there. Why the reluctance and the reticence to do it at this point in time? And so I'm just asking Barbadians, remember the 3 tenets in terms of the reduction of the transmission of COVID: wearing your mask, hand washing, hand sanitizing, and physical distances. Indeed, when last have any one of you seen someone with a common cold or the flu? This is the flu season. The transmission is the same way, but by just doing this, we're not dealing with COVID now, you have reduced the transmission of the common cold and the flu. So all I'm saying is that we have come too far. We have done too well. The health workers and frontline workers have worked too hard to get us where we are, for us to just throw it away and abandon the whole process that we've gone through diligently over these months. It is too important. This country cannot afford another lockdown at this point in time. It is imperative that we become our brother's keeper and ensure that we move forward and look after each other's lives and livelihoods. As I mentioned earlier, there are a number of issues that will be covered this evening. I started with the whole issue of the lab testing. I believe that some of you would have been aware that last week or so there was a backlog in terms of cases and test results because of a number of matters that arose in terms of the Best of Santos lab. As I speak to you, I'm aware that these matters have been resolved. They are back up to date, and persons can get the results within the anticipated 24 hours as stipulated in our protocol. The matter of the recruitment of additional laboratory staff and indeed persons to enter data, that has been done. I've been assured in terms of the testing kits that right now we have about 4 to 5 months supplies in terms of testing kits, even based on the increased numbers in recent weeks. As it relates to the time to get results, in terms of those who would have had a first test on arrival or are in quarantine waiting for results, there have been issues in terms of, as I said before, entering data, etc. There's a special unit now which has been established to deal with that matter. And they've started, not fully utilized, but I expect it to be fully implemented by January the 1st, an app that will assist in terms of the transmission of the various information in terms of when you key in data with the swabs and its transmission to the person's email. We're working so that in future, not only will the results be sent to the private doctors who were doing some of these testing in some of the hotels where there have been some delays in getting results, but also to the hotels so that they would have a spreadsheet, they would know who is cleared, and also the individuals will also have access to their results. While I'm there, in terms of the quarantine and the private quarantine facilities, there have been issues, a number of issues have been raised. I think you are all aware that we speak in our protocols of having government quarantine facilities at Paragon, at St. Lucie District Hospital, and at the Elaine's Canterbury Center, also in St. Lucie. And that in conjunction with the BHT, initially it was a few hotels, now it has expanded. A number of hotels have been cleared by the COVID monitoring unit to provide facilities for quarantine of persons who are waiting for the results of their second tests. The monitoring unit have been through the process, protocols have been drawn up, and there are issues with certain hotels repeatedly. I know that the COVID monitoring unit has been focusing on some of them, and I believe, and I know now, that the time has come we're in terms of working with you to get you up to where you should be in terms of quarantine of persons in your facilities without commingling. That time has come. I believe the COVID unit has worked, continues to work, and there's going to have to now to be some action in terms of hotel plans that are not complying in terms of what they have been advised to do by the monitoring unit. In this regard, the COVID monitoring unit has been expanded, and in addition, there is another quarantine engagement unit, which has also been established, so that one group will be working with the guests in terms of the test results, in terms of preparation for their second test as to where they would go, and the other one will be focusing on the demarcation of lines, so to speak. In addition, we've had discussions with the police and the defense force, and the time has come for us to have a rapid response unit. This matter of persons who are in quarantine, going to the front desk and calling taxis and leaving, that has to stop. The rapid response unit has to come into force to be able to be called to stop these persons when they attempt to do that. In addition, I've been informed that some of the hotel staff have been complaining that Barbadians, in their exuberance and excitement, especially around Christmas, when persons, relatives were coming in, were going to these facilities, even though their relatives are in quarantine, to try to get gifts and goodies and stuff that they had brought for them. And this you have to caution Barbadians. You have relatives in quarantine, you wait until they come out of quarantine. As it relates to the matter of recently, in terms of persons, I believe those have been vented and sorted out. The young lady who came from Switzerland, and I heard it on the news again this morning, it was in the newspaper, left the facility because she was unable to pay. I believe it is not common, but in terms of really hardship cases for Barbadians, and she's a Barbadian, that there is an arrangement in place through the Ministry of Tourism to facilitate the accommodation. So I'm not so certain who she would have spoken to in that regard before she took the matter into her own hands. Suffice it to say, she could not have done it in Switzerland. And I know that she will be quarantined when she goes back to Switzerland. We've had people calling for the banning of all flights from the United Kingdom in the wake of this new variant of the coronavirus, and the fact that the UK has shut down. Some countries across Europe have closed their borders to persons coming from the United Kingdom. And we've heard it here too, that we should do this. As I said at the outset, we are guided by the science. The science shows, and indeed for those who have been following the science, that there have been variants of the coronavirus from as early as August this year. Indeed, this new variant is about about 6 variants. And indeed, in the past 2 weeks, apart from the United Kingdom, South Africa has reported a variant, Nigeria has reported one, and indeed the Japanese are now looking at a variant. And this is a normal thing in terms of viruses, the flu virus, coronaviruses. And I think the advantage is that persons have not just started working on the coronavirus or the vaccine for the coronavirus this year. They've had, I think many of you remember SARS, it was a coronavirus. And they've been working on it in terms of its structure, and hence the alacrity with which they could develop a vaccine. The good news thus far is that the vaccines that are being distributed at this point in time would be useful, would be appropriate for this variation of the virus. The one thing we have to worry about is that it seems to be more infectious. And again, it goes back to us making prevention better than cure, and going back to the necessity for wearing your mask, hand sanitizing, and physical distances. As it relates to the vaccine and its access and coming to Barbados, these are matters I'm going to leave for the Minister of Health and the Chief Medical Officer. Suffice it to say that I've been informed that we expect to have vaccines in Barbados towards the end of the first quarter of 2021. I think persons might say, how come in North America and Europe they're starting the vaccines, what about us? I think you all understand the process in terms of how this is done. We are going through the WHO World Health and a COVAX system in terms of procurement of vaccines for countries. and 190 countries are part of this process. We are one of the 92 less developed and middle-income countries as part of the process. And it's being funded primarily by the developed world in terms of provision for vaccines to countries like ours. We haven't paid for it, of course. It's subsidized, however. If there's anything good in waiting, might be that while we wait, we will notice if there are any serious side effects, reactions to the drug, the vaccines that are being given. That is an advantage. Where it is being given more or less, you're still doing a trial, even though you've started giving it out. And that is that matter. As it relates to the whole issue of a variant and persons being worried about COVID and the coronavirus being mutated, this is normal, as I said. And the good thing about it is that it seems to be concentrated in an area called the spike protein, where you're just getting 1 or 2 changes, but the vaccine covers the entire, I'm putting it crudely, the entire spike protein, rather than getting into the details of the genomic structure. I spoke about our concern. Those are the concerns being raised by public persons and in the print media. Our concern is the congregations of large numbers of persons at events, especially recently, and as planned for the following few days in this week. And as I said earlier, these mass gatherings cannot be tolerated. COVID is still present, and government has to take action. Some things you have to guard people against themselves. It has been decided, plan has been, and the Attorney General is here, he will speak about it, that commencing on Wednesday this week until Wednesday the 6th, it will be considered a special period in which, and I don't want to speak out of turn, in which anyone who wants to have a gathering larger than 150 persons has to apply to the COVID monitoring unit and be sanctioned. Any event that is not sanctioned and over 150 persons will be closed down. At the same time, only events up to a maximum of 250 persons will be tolerated. Obviously, the mass gatherings that you saw at the beach and at various other activities will not be tolerated. We are bringing the defense force and the police into a joint patrol situation as occurs for crop over to deal, especially this week, because we recognize that a lot of persons are in that party mood, and we know that when you drink and you're partying, your inhibitions are removed, and you do a number of things that you're not necessarily going to do when you are in clear consciousness and thinking clearly, and one of them being wearing masks and physical distancing. So that will come into force. The Attorney General will speak in certain detail about that. In addition, we've had meetings with the cruise and catamaran people this morning, and we've gone through the protocols. They understand the protocols. They know also that in terms of the party cruises, that they may be in some trouble over the next coming days in terms of their requirements and the number of people that they take and the concerns. Suffice it to say, though, to monitor those cruises and catamarans, the Coast Guard will be brought into service to monitor them, and with directives if they are breaking the protocols to escort them back to the port. So I believe, in a nutshell, those are the main issues I need to do in terms of introducing the others to speak. Suffice it to say that the police, the defense force, and the COVID monitoring unit be establishing a policing plan for this special week in terms of how they're going to do surveillance and monitor. And indeed, at some of the hotels, which I say are not coming up to par, that the COVID monitoring unit will have persons there to monitor and ensure. And as I said, if they're not sticking to the protocols required in terms of hosting persons on quarantine, that facility will be removed from the list of entities which are allowed to do quarantining of persons. I thank you. I want to hand over to Minister of Health and Wellness to speak to some of the issues in greater detail, obviously. Minister Bostic.
Good evening, Barbadians, residents of Barbados, and visitors to Barbados. It is said that the race is not for the swift, but for he or she who endureth to the end. 2020 has been a particularly difficult year for us as a country, and especially so for those of us with the responsibility for managing the response to the COVID-19 pandemic. The last 4 weeks indeed have been particularly hard. But those of us who are responsible for managing the pandemic, we intend to endure to the end because we have to, for the sake of our country and our countrymen and women. I say that to say that if you look at the pandemic as a race, you know very well that in a race you can start very fast and still do not win. Conversely, you can have a slow start and still end up victorious. And that is because a lot has to do with the end of the race. We have to have a strong end. And I must say that although we've been doing quite well as a country, and we've been managing this pandemic well, I fear that as we approach the end of this year, there are some things that we've been seeing that would impact on how well we end 2020. And there's still a chance to pull it back, because how well we end 2020 will give us the impetus for the start of 2021 and the continuation of the race, or the continuation of the battle. I would have said several times that Barbadians, all of us, individually, we have a responsibility to each other for the spread of COVID-19 in Barbados. I would have mentioned on several occasions that we have several layers of defense, starting even before people arrive in this country and going right through the process. And that at the end of the day, it is not up to visitors or persons returning to this country who will determine how well we do, but it is up to every single individual to do what is required in relation to the protocols, the wearing of the mask, hand sanitization, etc. This is really where we need to focus our efforts in this fight. And this is where, regrettably, I can see that we are not doing as we should be doing. This is an all-country approach. And so we need for everyone, certainly for the remainder of this year and going into 2021, to do exactly what we were doing several months ago. I would have spoken last week to the hotel sector. You would have recalled that I would have indicated that tourism is their business, and I asked them to do their part. And I still continue to do so. We've had some breaches from quarantine. We've taken swift action to correct those. And we are satisfied that we have that, at this point, those breaches under control. But I want to say, beyond a shadow of a doubt, that time for speaking is over. And for those entities that breach or continue to breach the protocol, we are going to take action. And that action, I can tell you, is in progress as I speak, because we are investigating a few matters not related to people leaving quarantine, but to breaches of protocol within some of our hotels. And action is being taken and will continue to be taken until we are able to see the desired results. We would have spoken about issues in relation to testing, and I'm happy to report that over 1,000 samples were tested at the lab overnight, and we were able to deliver those results by 0600 hours today, that is 6 a.m., so that persons would have had back their results in good time. And we've put measures in place to continue with this, because we've been doing well all along. We've only had that 1 week where we've had challenges. And as I said to you, anytime we fall, we'll get up, we'll dust ourselves off, and we'll start all over again, because we are in this to the end. But I want you to be with us to the end. And I know that this is the festive season, And there's a propensity for people to enjoy themselves in several ways. But I want you to remember also that there's still the COVID-19 pandemic that is a threat not only to our country and our livelihood, but to the region and to the globe. And that we have a responsibility to continue to play our part. We have taken certain steps to ensure that we do not go back to where we were about a week ago. And we have placed some management structures in place, including utilizing some retired officers and medical personnel, retired officers from the Defense Force, to help us to manage the process, because this is national duty. This is a national threat, and this requires a national response. I'm also happy to report that we have improved significantly in terms of our monitoring of visitors in quarantine in hotels by establishing the Quarantine Engagement Unit, which is being headed by Lieutenant Colonel Kathleen Branch, retired Deputy Chief of Staff of the Barbados Defense Force, and she would have a team of about 30 or 40 persons, community health liaison officers, that we have now centralized their operations to be able to have a solid platform for us to do what is required and to monitor what it is we are doing. So all I can say to you is that whenever there has been an issue, we have responded. Whenever the Ministry of Health and Wellness required funds to be able to purchase things for COVID and to do things for COVID, the Honorable Prime Minister, in her capacity as Minister of Finance, has always responded to our requests. But that alone is not going to take us through to the end. The only way we're going to get through to the end, and to do so successfully, is if each and every one of us continue to do what we are supposed to do, and we know what we are supposed to do. So that some of the things that I have seen over the last few days in this country, really, I'm asking you, man, I'm begging you, put an end to it. Put an end to it, because we cannot monitor every single thing in the country. That is not practical or possible. But you can help us to monitor. You can help us to check on others. You can help us by speaking to your children and telling them to wear the mask and do the things that they're supposed to do. You can help us by doing these things yourself. You can help us by not going into crowded areas where people are not wearing masks. Help us to protect this country. Help us to protect you. I'm asking you. I will be here to answer any questions that you may have at the end. But for me, I want for us to end 2020 strong, so that we can start 2021 on good footing, on a solid foundation. Let us build on what we've been able to develop over the last several months, and don't let the negatives that have come into the system recently prevent us from achieving what this country is capable of achieving, because we have the capacity and we have people with the ability. And I'm calling on you to join together. Remember what the Prime Minister has said over and over again. We must be our brother's keeper. We must be our sister's keeper. This country, this fair land, this belongs to you and I. Let us keep Barbados flying high. I thank you.
Thank you, Minister Bostic. And I'm going to ask the Attorney General, the Honorable Dale Marshall.
Thank you very much, Jerome, Jeff. I think that social media has served to highlight to all of Barbados that in recent weeks there's been a certain recklessness attendant with the behavior of Barbadians. We would be naive to think that in our efforts to try to convince Barbadians to begin to moderate their conduct once more, that we did not need to have the support of the law enforcement side. In fact, in order to be able to give legal teeth to the support that the law enforcement agencies are going to be providing over the next few days, it is important for us to issue a new limited directive. And I therefore am here to begin by saying that effective on the 30th of December, ending at midnight on the 6th of January, a new limited COVID directive will come into place to buttress what is already there. Let me remind you that there's already a COVID directive number 4 for this state of emergency. And remember that we are still in a state of emergency. And that COVID directive does put obligations on individuals who are hosting parties and things of that sort to ensure that individuals who are attending follow the COVID protocols. But because of what we've seen and because of what particularly concerns us in this period ending 2020 and the start of 2021, we felt it was important to make some modifications. So the first one I'd like to give you now was mentioned by the chairman of this particular cabinet subcommittee on COVID-19, and that is that any person who wishes to host an event which will cater for more than 150 people must first seek the permission of the protocol unit. Now, that figure has changed over the years. Over the months. We were at 250, we were at 500, but given what we are seeing now, we feel it is important to tighten those particular screws. So the new number is 150 persons for that period, 30th December to 6th January. Individuals who have already been given permission under the existing COVID directive number 4, well, there's nothing that we can do about that. But let me say that the existing COVID directive number 4 puts a strong burden on individuals hosting events to ensure that all of the participants follow the protocols, sanitize, wearing of masks, and physical distancing. And in addition to that, where those establishments do not ensure that their patrons comply, then the COVID unit already has the power to shut them down. So what we're doing, though, is to reduce the ceiling so that anybody that wants to have an event of over 150 people must get the specific permission of the COVID monitoring unit. Because of the large number of events that we expect to happen over the next few days, it will be important to make sure that the members of the Royal Barbados Police Force receives the augmented support of the Barbados Defence Force. This is not uncommon. They already do it at Crop-Over. So I know it may seem a little bit of an unusual thing to say it on New Year's night, but there's simply too much at stake. And therefore, we will have a heightened set of joint patrols consisting of the Royal Barbados Police Force, led at all times by senior officers and supported by the BDF. Let me say too that the pleasure cruises, and you will have seen a lot of social media chatter about crowded vessels and so on, and we anticipate that some of this may be what people expect over the next few days. So for the first time, we are requiring, as a matter of law, that pleasure cruises must first seek the permission of the COVID unit. And the COVID unit will not just be saying yes or no, they will determine the maximum number of guests that a cruise can accommodate following their set criteria, and also stipulate any conditions that may be necessary. The fact is, and it does not do Barbados any credit, we know that people are following the protocols to get on the cruise. So they sanitize on entering, they wear their mask and so on, but the moment they get on the cruise and the vessel leaves the dock, masks come off and we seem to forget what rules obtain. I can say to you now that there will be a heavy presence of the Coast Guard on our shoreline, monitoring actively all of the pleasure cruises that will take place over this period. And in addition to that, we will also have the Marine unit. Of course, the Coast Guard has a much better complement of marine assets, and therefore we'll be relying on them. But if you have any doubt, let me remind all Barbadians that the Coast Guard are the police of the sea. And every power that the police has on land, the Coast Guard has in the ocean. And we've had a briefing with them, and they've been given strict instructions. We're not going to be bringing down the hammer the first time, but we are prepared to allow Barbadians some opportunity to come back to a position where they need to be. We're calling it the two-strike rule. So we're prepared to allow, not even to allow, we're prepared to accept that we will warn you once and we will warn you twice. But if the misconduct, if the failure to follow protocols persists, we will simply be shutting down all events that are in breach. So we're talking about pleasure craft on sea and festivities on land. We're also concerned about the congregating of large numbers of Barbadians, especially on our beaches and so on. And we know that a lot of Barbadians, this is a difficult economic time, and a lot of Barbadians are likely to go to view fireworks and things of that sort. And we feel that we have to put a damper on that, and therefore this current directive will stipulate that no group visiting a beach, and we may consider extending that to parks. We're working through that particular at this point in time. Will be able to exceed 50 people, and that they must observe the physical distancing protocols unless they're members of the same household. So for those individuals who want to go see the fireworks on Browns Beach, however it is, we're not going to put a stop to it, but we're going to insist that you are responsible and that the teeth of the law will come down on you if you don't. And of course, we are going to be insisting that people who assemble in public places shall comply with physical distancing protocols. This is not new. You'll remember that when we started to reopen parks and so on, that was one of the stipulations. But it has fallen off of the COVID directives, and we think it's important to put it back in place. Now, of course, the individuals who are hosting events or who operate entertainment venues, they have a legal obligation to defend the public interest. But the Royal Barbados Police Force and BDF will have the obligation to defend the public interest where, in open spaces, in other words. So beaches, streets, we know that there's been a challenge in Whole Town and so on. So in public places where the COVID directives will not focus on a particular event, then you can rest assured that the Royal Barbados Police Force and the BDF will be ensuring that the public is protected by dispersing those crowds if necessary, but always being prepared to allow people to have a reasonable spirit of the season and to enjoy themselves in such a manner as not to endanger the public of Barbados. So let me just repeat that we will be having a separate and distinct COVID directive covering the period of 30th December to 6th January. The existing COVID directive remains in place. This limited COVID directive serves just to tighten up a few areas that we feel are important enough that they should receive specific attention so that when law enforcement acts, they know that they're acting within the full power of the law. So we wish Barbadians well as we end this year. Minister Bostic has talked very eloquently about how we end and how we begin. At all times, our interest is ensuring that Barbadians live the most normal life that is possible at this difficult time. But as a government, the Prime Minister has always made it clear that if things get out of hand, we're going to have to press brakes. And what you're seeing now is not a return to any kind of lockdown, but what you are seeing is a recognition on the part of the government that people have begun to get a little reckless, and we need them to tighten up. And we are prepared to put the things in place to ensure that they do. Thank you very much. I'll hand you back over to the chairman.
Thank you, AG. Are there any questions?
Hi, good evening. Q Level Starcom Network News. Perhaps this is directed to the Minister of Health. I was wondering if we could get an update on the arrival of the electronic tracking bracelets that were to, right?
Thank you, sir, for that question. We have the bracelets on island, and we've actually tested the bracelets on some visitors. The challenge that we are having, but we've escalated that so that we can try to get the matter resolved, is that we were depending on Google and Apple in terms of getting the apps approved. Google has done so, but up until around the 23rd of December, and this is about 4 or 5 times, Apple has asked for additional information, which we've provided. And that is the reason why we have not rolled out those bracelets in full as yet. But we are hoping that once we can get some assistance in terms of getting the approval from Apple, that we'll be able to roll out the bracelets. But we have thousands of the bracelets on island, and they've been tested on some visitors.
Any more questions for Minister of Health so that we don't keep going?
Just one more. Ryan Broom, CBC. Minister, you had mentioned that there's an officer who will be taking charge of monitoring visitors at the an officer who would take in charge of monitoring visitors at the hotels. Exactly what would that entail? Is that temperature taking, or what exactly would that entail?
Thank you. Let me clarify that. We have a monitoring team in the Ministry of Health and Wellness that is responsible for liaising with, engaging persons who are in quarantine. And this has been going on throughout the length of the pandemic. They would call and get the temperature readings and so on, and they would also from time to time make visits. What has happened is that since the start of the winter tourist season, the numbers have increased significantly. And so that is one of the issues that we were having with that particular unit. And so we've decided to centralize the community health liaison officers to have a separate unit where they can be deployed to do exactly what I've just indicated, and also to be able to liaise with hotels and villas to make sure that test results have reached the hoteliers and those the villa agents, so that they can get to the visitors in a timely manner for those persons who require the test result, the second test result in particular, to be released from quarantine.
Carlos Saro, Nation Newspaper. I wanted to ask about the quarantine centers. I've heard that St. Anne's Fort is actually filled. Or is there any danger of these centers being filled to capacity, no more room, sort of thing? And also, cost. How much does it cost in Barbados to house people in government quarantine centers and isolation centers?
Well, I cannot give you the cost, but I can tell you definitely that there have been the odd occasion where the capacity at the Paragon Quarantine Facility, as well as the St. Lucie District Hospital and Elaine Scanterbury Center, that capacity has been overwhelmed on a couple occasions, but we have, and we've always had, well, we've had for the last several months a contingency plan where we utilize another hotel or a hotel that is for Barbadians who cannot get accommodation at the government quarantine facilities if they're full. And that's a plan B, and we have a plan C of another hotel which we've not had to utilize at this point in time. But yes, sometimes there are pressures on the government facilities, and that is why we've had to arrange with a hotel to be able to facilitate those persons.
Good evening. Just seeking clarification. It was mentioned that persons enter events and then they're removing the mask or wearing it incorrectly. Is it a stipulation or is it mandatory that at all events no persons are to continuously wear their masks?
From as far back as the opening up of Barbados, we have stipulated that individuals who are attending functions, that they must sanitize, physically distance, and wear masks. Now, of course, the question of continuously wearing masks requires relaxation in order for you to consume food and drink. But that exception apart, we are going to be insisting that people wear masks at these events. That is the law as it stands. There's nothing new about that. But on this occasion, what we're doing is stipulating it for the first time in relation to pleasure cruises, since we didn't have any specific provision dealing with pleasure cruises before. But the fact is that is exactly what is happening. We had a very candid and helpful meeting this morning with the operators of pleasure cruises and private charters, and they did indicate to us that people do exactly that they put on, they sanitize and so on, and they keep their distance as they're walking up. But the moment they get on board the ship, they're on now, and the ship has left the dock, so it drops down to the chin. Sometimes they just take it off. Now you will appreciate that on a pleasure cruise vessel where people have bought tickets essentially to just party. That is what they're there to do. They're there to dance. That's all part and parcel of the entertainment being offered. And we're saying we're not going to put a stop to it, but it has to be done responsibly. So we've already sent a message to all of the pleasure cruise operators that they're going to have to look seriously at their numbers. The COVID monitoring unit will have the enlarging responsibility of directing them as to the number of people that will be allowed to get on board of the vessel. There's already an informal protocol in relation to charters, and that says that each person should have 10 square feet space around them if you're wearing a mask. But if you're not wearing a mask, then that figure goes to over 30 square feet. Now, obviously, if I have to have a 30 square foot area around me if I'm not wearing a mask, then it will stop the charter from being viable. So it is in the best interest of the charter operator, it's in the best interest of the party cruise operator to work with us. Remember always that the COVID monitoring unit have the full lawful authority to shut you down. They've already shut down businesses before. They've shut down businesses on land. They will continue to do so when necessary. And if necessary, they'll be terminating cruises and grounding, quote unquote, those vessels where people do not comply.
Just for clarity, the rapid response unit, that's to be set up by when?
Well, it's being set up as we speak. We are anticipating, well, let's back up a little bit. We recognize that there have been instances over the last few weeks where we needed to have a structure so that the police can respond where individuals breach protocol and so on. So that rapid response arrangement has been put in place. But over this special period, this end of year holiday season period, it will take on a bit of a different face, because we will actually now be augmenting the resources of the RBPF, and we'll be making sure that they are in all of the locations. We already have a list of the various festivities. I'm not saying that you can have police at every location, but those locations that are required to have police presence, those police will have been briefed and told, you are not just there to secure the venue. You're also there to secure the public of Barbados by ensuring that patrons in this place follow the COVID protocols.
On to that, in relation to two strike rule.
Yes.
How exactly does that work? In other words, you just mentioned if a vessel moves off, let's say that when they move off, they're checked, people are wearing, and then is it continuous through the whole night, or is that?
Well,
how does it work?
We are putting a burden, an obligation on the owners of these pleasure craft. And that's why we met with them today, so that there's no doubt in their mind the standard that we are expecting them to hold to. A person who has a pleasure craft has employees, he has obligations, and he doesn't want to be grounded. Now, I've said to you that the Coast Guard will be in heavy presence along our shorelines, and also the Police Marine Unit. This is not new, they do it all the time. But generally in the past, they were doing it in case fights break out, unsafe situations arise. Now they're going to be doing it specifically with COVID in mind. Now, a BDF vessel will easily be able to spot and look on a party cruise and see if people are physical distancing or not. They'll be able to see if people are wearing their masks or not. So in terms of a two-strike rule, we're saying to them, give people a chance to correct themselves. Give them an opportunity to salvage the cruise. Don't just go in and shut them down. But if that kind of behavior persists, then bring an end to it. And that's happening onshore or offshore.
Attorney General, could you please clarify for me the 50 number congregating on beaches?
Well, I'm not sure what you want clarified about 50. 50 is more than 40 and
50
less
people
than
on the
100.
beaches or what?
Listen, I think if you've been following social media, you will have seen that the beach venue has become a very popular space for Barbadians to get together to party. Maybe because it's cheap, maybe because it's outdoors, whatever it is. But when you see the footage and photographs of what has been happening, you recognize that it presents a problem. Now, we've already said that you can host an event. If you're having over 150 people, you need to have the permission of the COVID unit. We recognize, though, that beach gatherings will develop spontaneously. I know people who are already planning on going on the West Coast to view the fireworks. They're not having an event that you would say they seek the permission of the COVID protocol unit. That is more of a spontaneous gathering. So we're saying, look, we understand spontaneity, we understand spontaneous gatherings, but some rules have to apply. And therefore, we've tried to come up with a number that recognizes extended family gatherings, that recognizes people in a bubble. I wish I could say that there's an exact science to it. The figure at this point in time, that's the kind of figure that we're looking at. We're certainly going to be fine-tuning, so that may change. But at this point in time, as I have drafted the protocol, we're saying that we will limit you to a gathering, a spontaneous gathering of 50 people in beach locations. But even then, you still have to follow the protocols of physical distancing.
Per group, 50 per group.
Yeah, a gathering, yeah. But we you know, there's no, if you follow what has been happening overseas, in England they say 2, they say 3, sometimes they say 9, 2 families. It's difficult to be precise, and we're at all times trying to protect the society while allowing Barbadians to celebrate the end of the year reasonably. And we think that is a kind of arrangement that could work for us, and it would see a stop to the excessive crowds. I'm sure you've seen some of the footage. Hundreds of people gathered, all partying. And
I asked the question because Youth Day Old Year's Night, you have hundreds of people on the beaches stretched
and
all
we're
around.
not going to stop hundreds
Yes.
of people from gathering on the beaches, but what we're saying is we're not going to allow hundreds of people to gather in a single location. So they're going to have to break it up. They're going to have to spread out. You know, we don't want to chase people off of the beaches. We don't want to go back there. So we're trying to find a measure that allows people the facility, the benefit of enjoying the fireworks on the coast, enjoying the morning sunrise on the other side of Barbados, the East Coast. But at all times, we're going to be having an eye to how many people are gathered.
Thank you.
Good afternoon, Mr. AG. Mr. AG. Yeah. This is a follow-on from Gersine's question. It has to do with spontaneous gathering. I'm wondering just exactly how far the law enforcement officials are willing to go. Usually when we speak about crowd dispersement, especially in circumstances where people are intoxicated, there are specific places on the West Coast where persons gather to party in the street. How far is the police willing to go? Are we talking loudspeakers, riot gear? How far?
I leave the police the policing to the police officers. They are trained. I don't know where you would introduce the concept of riot gear. We're not dealing with a riot at all. The Royal Barbados Police Force, augmented by the BDF, are well able to disperse crowds. They've done it before. It's not going to present any difficulty. Will it be loudspeakers? I don't know. I'm hoping that we don't have to ramp up to that level. And that's why we're saying we're gonna say to people, come on, put on your mask, be reasonable. We've been encouraging individuals who are having events to keep masks and just give them away to patrons so that there's no issue. If you forgot one, come here, take two. But they will do what they have to do to disperse a crowd if necessary. But I don't anticipate that there will be any concept of riot gear or anything of that sort. I think when the police come and speak authoritatively, I expect Barbadians to comply.
And when it comes to the persons allowed to have events beyond 150, is there a blueprint, a set of specific things that they would have to satisfy, criteria that they would have to satisfy?
Absolutely, and I repeat, this is not new. All that we're doing here is lowering the ceiling, okay? Prior to now, in fact, if you were having an event today, there's a COVID directive that says to you, if you want to go above a certain number, you have to get the permission of the COVID Protocols Monitoring Unit. They actually go to the venue, and they don't go with a tape, but these are trained individuals, so they will have an idea, well, this venue, if we had to physically distance, can accommodate no more than this number, and they will limit you to that number. But then there are issues like how many bathrooms do you have available, because that can also serve to reduce the number. So the COVID Protocol Monitoring Unit will require you to meet their minimum standards if you're going to have an event. If you don't meet those standards, then you just will not get the permission.
The 150 people, does this also include churches as well?
There's a protocol in place for churches that has not been changed. Churches do not, if you think about it, sir, churches do not currently have to say, I want to have a church service.
Churches that see the 150.
And we have a protocol that says specifically how churches will operate. That protocol does not change over the season. We're not, the churches have been following the protocols, and we expect them to continue to follow the protocols in this instance. It is the reckless behavior that as a government we are seeking to clamp down on at this point. So the churches, unless you know something that I don't, the churches we're not changing their directive.
This question is for
Thank you.
Minister Bostic.
I was beginning to worry.
Yeah, recently, the Barbados Association of Medical Professionals made a suggestion, given that we are not going to be banning flights from the UK, that we at least extend the quarantine period for medium and high-risk countries from a minimum of 5 days to a maximum of 7. Is that being actively considered by the ministry?
It is not being actively considered. Let me say, first of all, that we welcome the participation of the Barbados Association of Medical Practitioners within our Health Emergency Operations Center. They are represented there, and these matters are discussed at that level. I would also like to say to you that out of the abundance, I don't want to say caution, but just to keep things going between the BAM and the Health Emergency Operations Center, several weeks ago, I would have had a meeting with officials from the World Health Organization and PAHO dealing with similar matters, and BAM was invited to participate in that meeting. And this discussion was held by WHO, and they have basically endorsed what we are doing, because what we are doing is following the science, and we take guidance from the World Health Organization. And the other thing that I would like to say, and out of me with no disrespect whatsoever, as I said, we welcome BAM. They do perform a function, and we respect BAM. But as Minister of Health and Wellness, I have to take the guidance from my public health officers because they're the experts. There's a difference between public health and what other people do in the health services. And my professionals are very, very knowledgeable. And we have not only those, but we have guidance from the PAHO office here in Barbados, and we have guidance from the World Health Organization. And I will hasten to add that our experience so far, we have caught persons on the second test. Our positive cases, for the most part, the protocol is working beautifully. It has done exactly how we expected it to do, how we expected it to perform. And at this stage, we do not see a need to change the quarantine protocol. But if things change, because obviously this is a dynamic situation, then we will adjust accordingly. But at this point in time, no.
Richard Carter would have held the post of COVID-19 czar earlier this year and has since left that post. Is there any intention by government on filling that position?
Richard Carter, yes, he performed a very important role, and for personal reasons, having to return to his job, and he had indicated that it would only have been for a period of time that he would have been able to give his time and his service to the country. We have been relying to some extent on Mr. Chapman, who's head of the COVID monitoring unit, but the government has been having discussions in terms of finding a replacement because we still believe that that function is an important one. But that one is being discussed at this point in time. It obviously is beyond the Ministry of Health and Wellness, and as soon as we are able to find a suitable replacement, the public will be notified.
Minister Bostic, are you satisfied with the level of enforcement that has been happening so far? And as a kind of a follow-on to that, is anything being done in terms of prosecution of the last person who would have publicly announced about breaking quarantine?
All persons who break quarantine, and the chief medical officer is dealing with this matter because he has the remit to do what is required by law. But all persons that have broken quarantine, and especially within recent times, those persons, once we have all the information together, we will do what is required to ensure that those persons are brought before the law courts, because this is a serious matter. And I'm glad you asked the question because I would like to take this opportunity to say to our visitors, we welcome you, as we always do. Tourism is our business, and we welcome you. But this is a pandemic that we are fighting. And I'm urging you, I know it may be difficult because some of the things that we do here in terms of our protocols may not apply in the countries where you come from. But the safety and the public health situation in Barbados is our business. That's our concern. And I'm begging you to follow the established protocols here in country. You know the protocols from the time you arrive. Quarantine is quarantine. There's nothing strange about quarantine. If you fail to follow the protocols, as some have done, then you will be in breach of the law, and the Ministry of Health and Wellness will do whatever is required to be able to bring you before the courts of law in Barbados.
Speaking of hotels, sir, I want to find out, here is the armbands, the different colors of the armbands that are being used. Can you break that down for me?
You're probably speaking about the armbands that are utilized within the hotel sector for the
Hotel
designation. Sector, yeah, I'm not, that is not the Ministry of Health and Wellness. I really cannot tell you exactly what those are. The hotels are dealing with that. I can tell you about the bands, which was asked, the question that was asked earlier, which is the wristbands in relation to geofencing and being able to have alerts when people move out of the area of quarantine.
Would you then be able to give any details on what's being done against those hotels on investigation? You said there was some being investigated.
Yeah, they're being investigated, as I said, right now, some of them. As soon as those investigations are being completed, what will happen is that hotels that continue to flaunt the protocols, as some have been doing, they will be removed or delisted from the list of designated quarantine hotels. And I say that, and I mean that. And that is going to start to happen very, very soon. Perhaps as early as by tomorrow morning, that action will start. Because we cannot and will not tolerate a continuation of the flaunting of protocols. And I know people call me colonel, but I'm not a colonel for nothing. There's a serious side of this colonel, and some people are about to see that serious side. The country cannot afford for people to recklessly flaunt protocols in this country. Barbadians deserve better than that. And we want this to be a safe destination for visitors and a safe place for our people. So hoteliers and all those responsible for visitors must play their part. The visitors must comply with our regulations and our protocols, and then we can proudly continue to promote Barbados as a safe destination for all.
All right, then. Can you say if the government is selling the testing kits to hotels to do testing at the hotels? Private doctors may be doing testing at hotels as well?
That has been going on for quite some time. We welcome, and I dare say we depend on private doctors to assist in this process. It's a national effort, and there's a fee structure that has been arranged to be able to deal with that, so that the Best Dos Santos lab is compensated for testing kits and so on.
I'm glad you said fee structure, because I'm hearing that some of these fees are going up in the air, man. That some of these private tests are...
Well, we don't control the private testing fee structure that I alluded to really is in relation to what we, the government, requires so that we can replace the testing kits that are utilized by private sector entities.
So they pay you a set amount? They pay you?
There's a
set
fee
amount,
structure, yes, there's a fee structure.
But they may end up charging more, but I guess you said that's not...
Well, that's up to the persons who want to get the private test. If they want, it's a market. If they want to pay for it, they pay for it. But we don't have any control over that.
All right, then. Last one for me. I'm seeing here Barbados listed itself on the travel protocols for the first time.
Sorry, could you repeat?
Barbados listed on the travel protocols as medium. I want to ask you about that. This is the first time we've been on these protocols, I understand. I don't know, that's what I'm seeing here.
I will,
Travel protocol, I guess, from...
CMO, I will invite the CMO maybe if he can assist with the answer for that one.
Good afternoon. We have had a method that we have been using for quite some time, I would say for the last 3 to 4 months, that has regular updates on how we list countries, and we list Barbados on that listing also. That has worked for us. Other jurisdictions have the right to list us based on their calculations, but we use our calculations, and when the protocols are updated, we also update the risk ranking of countries. So therefore, what has worked for us, when Barbados called St. Lucia and a few of our colleagues within the region and raised the bar, there was some disquiet. But we held firm to our belief with respect to the categorization of some countries. And when the countries fall in the risk rankings, we will be the first to return those countries to their original positions which they held. It's a transparent process. Thank you.
Oh, yeah, sir. Dengue and Green Hall Swamp. Anything to say about that?
Any other questions as related to COVID? I'll come back to your question about dengue.
Yeah, just one other question regarding COVID. Perhaps Dr. George might be best equipped to answer this question. Or the minister? Yeah. It has to do with the COVID-19 cluster that we read about early last week. over the last few days, we would have been hearing in the daily COVID-19 updates, perhaps one or two persons who have contracted the illness, but who did not come into the country. It was through contact tracing. So I just wanted to get an idea of how many of the more recent cases came out of that cluster, came out of the second testing that was promised.
I think there were 1 to 2 cases. The contact tracing is, let me tell you, contact tracing occurs on a daily basis. This is nothing new, right? It's part of the process of good public health, so that if an individual comes to Barbados and has tested positive, we always look at that individual and the immediate contacts. We are actively doing so many forms of contact tracing in Barbados. But what I can tell you is that there have been no outbreaks, there are no clusters, there is no local transmission, there is no community transmission. But once we are in a pandemic, you're going to have the public health teams always doing these types of investigations.
And just following on from that, this is for the minister, and just to be abundantly clear, I know you alluded to the fact that the law would be coming down on any persons in breach, but specifically, just for clarity, the person or persons suspected to have been responsible for the creation of that cluster by breaching quarantine. I mean, I suppose at this point they may still be in isolation, but that's what was said.
I know this is about the third time you've been asking me about a cluster, but let me say, I know
that
what you're referring to.
That was based on information that I received from the government.
Let me say what you're referring to. That matter has been put to rest. All of the persons who were contacted in relation through contact tracing, those persons who were thought to have been exposed in any way whatsoever, those persons have not only been tested once and quarantined, but second test as well, and all have been negative. So there's absolutely no issue in relation to that particular case that you're referring to.
Thank you.
I think there are no more questions on COVID. And Mr. Atwell, you wanted to ask a question about dengue fever? One question.
Graham Hall Swamp, are you satisfied that you have it under control in terms of mosquitoes there? Or would dengue be a problem going into 2021?
Where's that, the Graham Hall Swamp?
Graham Hall, yeah.
So we have always looked at the swamp very, very carefully, because the swamp, many of you know, on a small basis has Anopheles mosquitoes also. That's not a secret. So we also have 2 vectors in the swamp, the Aedes aegypti and the Anopheles, and we continue to make sure that the southern part of Barbados is always fogged, and the teams go out on a repetitive basis. Our challenge is that, yes, we did indicate that for October, our levels were a little higher than the standard call. So it did meet the threshold for an outbreak, but fortunately for November, those levels turned back to the levels that have been seen in previous years. So therefore, at the moment, it's a bit too early. There is increased activity, and it is just a good opportunity that, while even talking about COVID, to remind Barbadians that fogging, yes, the environmental inspectorate, yes, but they have indeed their responsibility to make sure that their premises is checked twice a week for mosquito larvae. Thank you. No, so there have been several hospitalizations. You might have heard in the press that there were several deaths in the region, but fortunately, Barbados, we have been, I would say, blessed, but we have to keep up our guard on this. And while in a COVID pandemic, the Ministry of Health will keep its eyes on all areas of public health significance. That's what we try to do, to make sure that the public is safe. Many issues surrounding public health require the public's cooperation. And that, I think, the media is well placed to encourage the public to understand the science and take simple measures to protect themselves and their family. Thank you so much.
I want to ask the Minister of Health and Wellness to speak in terms of the expanded program in terms of dengue fever.
Yes, I would have addressed this issue before, but let me reiterate that the government has determined that we treat to dengue or a dengue outbreak in the same way that we are treating to COVID, same level of seriousness, and the same approach with the Health Emergency Operations Center being responsible for launching the effort. We have contracted about 40 additional persons, for example, to assist the environmental unit to be able to go out there, and they've been out there on the ground trying to locate mosquito breeding sites. We have spent a considerable amount of money in terms of purchasing both handheld foggers as well as truck-mounted foggers. We are waiting the arrival of the foggers, and as soon as those machines are here, then we are going to be able to deploy 4 fogging teams, 2 in the northern half of the country and 2 in the southern half, with a 5th team that will be able to respond to any isolated incidents. We've been mapping information in relation to persons who have been suspected of contracting dengue, and we've been targeting those areas with the current capacity that we have, and that will continue throughout the next several months, and especially when we have the equipment in that we can deploy all of the teams that we now have at our disposal.
Okay, I want to thank you all for your questions as I close, and thank my colleagues for participating, and Dr. George. I want to reiterate what has been stated by the AG and the Minister of Health and Wellness in terms of and I spoke to her earlier in terms of the time for warnings and working, especially with hoteliers, is over. It is now for time for enforcement. I mean that. In addition, I spoke also, I cautioned visitors that while they're here, we welcome their presence, but they must abide by our protocols. And I believe that soon someone will be prosecuted. I say so. I guess you all will keep me tuned when it does happen. And I just want to reiterate that we will prosecute hoteliers. We will stop quarantining at hotels if we have to. We will prosecute persons who breach quarantine, be they a visitor or Barbadian. Indeed, I believe a visitor was already prosecuted earlier this year, as I recall. It is not new. It has happened, and it will happen if it has to take place. I want to say that. I want to entreat Barbadians over the next couple of days to be safe, take the necessary precautions in all that they do to exercise restraint, exercise extreme restraint. We have warned you that in terms of gatherings of large numbers of persons, this is not going to be allowed. And I want, at the end of last year, we were all excited about the prospect of a gathering 2020. I want us at the end, as we approach this end of this difficult year, where we do see some light at the end of the tunnel in terms of the vaccines, that if we work together and take the necessary cautions and precautions and observe the protocols, that we could set it as our target to be able to gather at the end of December next year and perhaps indulge in some of the things that we are not going to be allowed to do this year. I want to all of you again to ask you to be cautious and to be safe. And I want to thank all you ladies and gentlemen of the media for your presence. It's been quite a long time. I believe we'll be here for an hour and 20 minutes. I thank you sincerely, and I wish you all good health and all the best wishes in 2021. Good evening.